COVID-19 update. Total confirmed cases in West Virginia is 593 as of April 12th at 9 a.m. U.S. cases are more than 533,000. Total deaths in West Virginia is 6 as of April 12th at 9 a.m., while U.S. deaths are 20,601. The total recovered is 32,026. Harrison County has 29 confirmed cases. Mon County has 81 confirmed cases. Marion County has 32 confirmed cases. Wood County has 18. Marshall County 6. And Wetzel County 3. Governor Jim Justice issued the following order for Harrison and Monongalia and Kanawha counties last week and added Marion County to the same order this past week. Limiting groups to a maximum of 5 people, directing all businesses to require employees to work from home to the maximum extent possible, directing local health departments to establish maximum occupancy and proper social distancing within essential businesses and to take action to enforce these health regulations, directing the West Virginia National Guard to provide logistical support and services, and directing the West Virginia State Police to assist with the enforcement of local county orders. Harrison County Health Department order effective April 6, 2020. 1. Stay at your home or your place of residence. All individuals within Harrison County are under a general stay-at-home order unless performing an essential activity as defined in Section 1 of Governor's Executive Order 9-20. A. No gathering size of any group engaging in outdoor activities to be more than 5 people and still maintaining a 6-foot distance from one another at all times. B. Limit your visit to the home of a family member to the least number as reasonably possible. 2. Essential businesses and operation. As defined in Executive Order 21-20, all essential businesses and operations as outlined in Section 3 of Executive Order 9-20 shall direct employees to work from home to the maximum extent possible. Businesses that remain open must implement the following. A. Implement a written plan to limit staff to essential personnel only. B. Implement social distance practicing in the workplace where possible, 6 feet apart from other persons. C. Supply multiple adequate disinfecting and hygienic supplies and dispensers to employees and other persons on site. D. Provide protective barriers for employees exposed to the general public. 3. Public access restrictions. All essential businesses and operations as defined in Section 3 of Executive Order 9-20 that remain open to the public shall limit access to the public as follows. A. No more than 2 persons per 1,000 square feet of public space in any such building or any attached or adjacent area where persons may likely congregate. B. All such employers shall take action to establish social distancing for the public to the greatest extent possible. C. Any businesses that remain open to the public shall promptly display at all entrances and exits and checkout counters with at least a minimum of 5 notifications posted, including posting the maximum person occupancy. Four, self-quarantine for positive test. Pursuant to the general authority of the Harrison-Clarksburg Board of Health to order quarantine of individuals contained in West Virginia Code, 16-3-2, any person who is diagnosed with COVID-19 shall self-quarantine for at least 14 days in a portion of their own home that limits, as much as possible, their contact with any other member or person in their home at any time. Any person diagnosed with COVID-19 should use his or her own bathroom exclusively. Number 5, enforcement. The enforcement of this order shall be at the direction of the Harrison-Clarksburg Board of Health, pursuant to Executive Order 21-20. The West Virginia State Police and other law enforcement agencies are directed to provide support in enforcing the terms of this order. A. Pursuant to the Executive Order 21-20, the National Guard shall support the local health department by assisting with spot checking businesses and with any other support deemed necessary by the health officer to require compliance with the regulations established. B. All law enforcement officers acting at the direction of the Harrison-Clarksburg Board of Health are charged with the enforcement of this order. Any person who violates a lawful directive from such a law enforcement officer is subject to the penalties stated in West Virginia Code 16-2-15, which provides a misdemeanor penalty for any person who obstructs any person charged with the enforcement of any public health order. C. Any person who is notified by a law enforcement officer that they are in violation of this order and who does not take the requested action to come into compliance with this order within a reasonable amount of time is hereby declared to be a nuisance affecting public health, pursuant to West Virginia Code 16-3-6. The law enforcement officer is authorized to apply to the Circuit Court of Harrison County for an injunction to restrain, prevent, or abate such nuisance. So, what does this order mean for Robey Excavating? 1. The office and shop will be closed to the general public. We do not offer the public general access like grocery stores and retail stores. However, we do have persons searching for employment enter the office area. For this reason, all public persons will only be allowed access into the entryway or porch area of the building. This will be limited to one person at a time. We do not fall under the square footage rule for the general public restrictions. 2. Deliveries will be handled in the same manner that we have in the past few weeks. All delivery persons will notify through the front office to Cindy. Delivery persons will only be permitted into the shop area if the number of total employees and delivery person is 5 or less, and only as necessary to complete their delivery. Deliveries that can be dropped off outside the shop is the best practice at this time. 3. Only supervisors, truck drivers, and office personnel are allowed in the shop and office area of Robey Excavating. Only exceptions to this rule is when an employee's work vehicle has maintenance scheduled, the employee has training, or the employee must use the phone for business-related reasons. There should not be more than 5 people at one time in the shop area. All persons must maintain a 6-foot social distancing space between themselves and all other employees, delivery person, and public. 4. Job sites will continue to practice no groups larger than 5 people in one area, and those workers must practice the 6-foot social distancing to the best that they can. The number of people in this group shall include supervisors, employees, inspectors, and safety personnel. 5. If an employee tests for COVID-19 virus, that employee will remain off work until the results are known. Positive tests. The employee must self-quarantine for 14 days. If an employee has been around anyone who has been tested for COVID-19, must not come to work and self-quarantine until the results are known. If an employee was exposed to someone who tested positive for COVID-19, they will not report to work and self-quarantine for 14 days. A practice that is new and on the rise in our area are virtual doctor visits. Here's how to perform a virtual doctor visit through our company's insurance. Highmark of West Virginia. You can follow these simple directions to create an account. 1. Visit amwell.com or doctorondemand.com and follow the instructions to register or download their mobile apps. You can use either or both of these services. Enter your name, address, complete the brief online health history form, and enter your health insurance information. You can choose the doctor that's right for you. Look through the doctor's profiles. Choose a doctor and click Start Visit. Tell them what you'd like to discuss. Tell us if the visit is for you or your child, and tell the doctor the reason for your visit, and begin your live video visit. Get the information fast after your visit. View the doctor's notes and diagnosis. If you're prescribed medication, it will automatically be sent to your pharmacy. See a doctor on your own time and pay less than at urgent care. On the website, there is a video you can visit a doctor using your computer, tablet, or you can use a smartphone. You will have 24 access to virtual medicine for you and your family, day or night, 7 days a week. Again, register and download the app to get started. Visit amwell.com or doctorondemand.com and follow the instructions to register and download their mobile apps. Each supervisor will be given paperwork from the office to hand out to employees to notify them of the virtual doctor visit. West Virginia University Medicine Urgent Care is also providing video visits. To help lessen the spread of COVID-19, all WVU Medicine Urgent Care locations are now offering virtual video visits at no cost for adults and children ages 5 and up. Adults and children ages 5 and up can video chat with an urgent care provider via a smartphone or webcam equipped computer from 8 a.m. to 8 p.m. Monday through Friday and from 10 a.m. to 4 p.m. on Saturday. This service is for patients who have minor medical conditions and not for emergency. Those with emergencies should call 911 or go to the nearest emergency care location. Pre-screened drive-through specimen collection. West Virginia Medicine has established 5 drive-through collection points in West Virginia to collect specimens from the pre-screened patients to test for COVID-19. The collection points are located in Morgantown, Parkersburg, Bridgeport, Wheeling, and Martinsburg. Tests will be reserved for people who meet screening criteria based on the CDC recommendations and are sick with symptoms that are consistent with COVID-19, such as fever, cough, and shortness of breath. Again, consider a virtual visit. All West Virginia medicine outpatient clinics are now offering video visits for most outpatient services, allowing established patients to receive care from the comfort and safety of home. Request your virtual visit by calling 855 WVU CARE or 855-988-2273 or by sending your provider a message through the My WVU chart. On March 14th, 2020 at 3:08 p.m., Levi Talkton sent in a safety observation for the proper use of a wheel chalk and cones on a parked truck and trailer. This was completed at Arbutus Park. On February 25th, 2020 at 6:32 p.m., Garrett Swagger sent in a safety observation from Arbutus Park for a vehicle wreck. An individual drove through the road closed signs and cones and struck a parked car. What Garrett did about it was make this report and contacted our safety department.
This week's Safety Toolbox talk is on flagging and spotting vehicles on our projects. The unions here in Chicago have notified us as of late that flagging is primarily supposed to be done by laborers. It appears that the job description for laborers includes flagging, and apparently we have other trades trying to assist vehicles pulling into our job sites and backing into our job sites. So primarily speaking, from this point on, let's try and use our laborers for this task. A flagger and or spotter, according to the Safety Toolbox talk, should be certified. Now, there's a misunderstanding out there about flagging. When you go to the training, they don't necessarily hand you a flag to be flagging. If you're out in vehicular traffic and you need to be flagging, we are supposed to material wreck and have on our projects the stop and slow octagon sign. That is part of the laborer's training that you would take in their class, okay? The octagon sign, not necessarily a flag in itself. Now, when we have a job up and running and we're pulling vehicles in and off the streets and within our site fences, a flagger is really a necessity. Within our nucleus of the American Contractors Insurance Group, they do have an icon in the life-saving commitments, crushed by, caught between, and or working around motorized equipments. There's been an awful lot of bad accidents that have occurred in the last couple of seasons with our fellow members from our insurance captive, and those gentlemen were either severely injured and or they became fatalities. So this is a must on our projects: flagging, certified training. Who has it? If you're currently carrying a card, I would like for you to notify Gary McLean and make sure that he knows that you are a certified laborer flagger. When is it necessary? Let me give you a few line items. Always wear your high vis so as he's backing up he can see you, and don't get in his blind spot. Typically stay on the driver's side of the vehicle and hand signal him backwards, left, right, whatever it might be, so that he can see you. Look out for yourself, look out for other tradesmen on the project, look out for staged materials so that they don't get run into and or damaged. Never pass out a view of the driver without stopping the vehicle. If you've got to walk behind that vehicle, stop them. Right? Stop them. Let's cover that this week. And our safety toolbox talk before somebody gets run over within our site fences or out on the streets. Let's have a safe week.
Life workplace hazards. Don't get bit. One thing to watch out for on job sites are venomous spiders, such as the black widow and the brown recluse. The black widow, the venom is neurotoxin that produces pain at the bite area and then spreads to the chest, abdomen, or the entire body. Where the brown recluse has a smaller white blister, usually develops at the site of the bite. The venom of the brown recluse can cause severe lesion by destroying the skin tissue. This skin lesion will require professional medical attention. You also should watch out for venomous snakes. Which one of these three snakes is not poisonous? The northern copperhead, the eastern rat snake, or the timber rattlesnake? If you guessed the eastern rat snake, you guessed correctly. It is a non-venomous snake, and as a baby it appears to have markings of most venomous snakes. To the right you can see a photo of an adult eastern rat snake. Looks very similar to our own black snake here in West Virginia. Another hazard we must watch out for on the job site are ticks. Several employees have reported pulling ticks off of clothing during the past few weeks. The most effective method for protecting oneself is to regularly check for ticks. The probability of a tick transmitting a disease-causing pathogen increases the longer an infected tick is attached. Using a DEP-based repellent on skin and a permethrin-treated clothing can also provide good protection. If an attached tick is found, remove it by using thin-tipped tweezers or forceps. Grasp the tick, as close to the skin as possible and pull the tick upward with a steady, even pressure to remove the tick with its mouth parts intact to reduce the risk of infection. The safety department also has tick spray for each crew. On job sites, you should also watch out for mosquitoes and ants. Insect bites are puncture wounds or lacerations made by insects. An insect may bite in self-defense or when looking to feed. Insects typically inject formic acid. This can lead to blisters, inflammation, redness, swelling, pain, itching, and irritation. The reaction depends on the type of insect and the individual's sensitivity. Bites from fleas, mites, or mosquitoes tend to cause itching rather than pain. Individuals react in different ways. In one person, a bite might cause a small, itchy bump that resolves itself in a few days. In another, the same bite can have a more serious effect. Infection might occur at the site of the bite, causing redness, warmth, and hardening of the skin around the area, with pus draining from the wound. Scratching the wound can also lead to infection and leathery, thick skin. People who work outdoors or regularly practice in outdoor activities are more at risk for insect bites. Some more hazards on the job site would include wasps and yellow jackets. Dogs and cats can also be a hazard on the job site. Other wildlife to watch out for would include raccoons and common rats. If you get bit on the job site by an animal that punctures your skin, seek first aid treatment immediately. Notify your supervisor and Robey EHS and then call Axiom Medical. Axiom Medical will advise on what steps should be taken from that point. If the punctures are more serious and bleeding cannot be contained, seek medical assistance at the nearest medical facility. Supervisors, be sure to complete your JSAs and toolbox talks with your crew members. Have each member sign the JSA form and send a photo of the JSA to Mike Limley's cell phone. The photo will be our record that the weekly training material was observed by all employees. Thank you and have a safe work week.